Do you frequently feel like your heart aches sometimes? Or maybe you've been feeling unusually tired, even after a full night's sleep. What if you've had a fever that just won't go away for weeks? These might seem like everyday issues, but when they pile up, they could point to something serious, like miliary TB. Imagine tiny TB bacteria spreading like dust through your body, settling in your lungs, liver, even your brain. That's what happens in disseminated tuberculosis, also called miliary TB, named because the spots it creates on X-rays look like millet seeds. It's rare but dangerous. Have you or someone you know felt sick all over without a clear reason? Let's find out what could be going on. So what causes miliary TB? Think of it like a spy that sneaks into your body and lies low for years. The culprit is a germ called Mycobacterium tuberculosis. Most people catch it by breathing in air from someone who coughs or sneezes with active TB. But here's the twist. Your body often traps the germs in a cage of immune cells, like locking them in a tiny prison. The problem starts when the germ breaks out, maybe because your immune system is weak from HIV, diabetes, or medicines after an organ transplant. Then the germs hop into your bloodstream and spread like wildfire to different organs. It's like a jailbreak gone global, inside your own body. Now, how would you know if it's miliary TB? Let's play detective. Have you been feeling feverish every afternoon, losing weight without trying, and sweating heavily at night, like you just ran a marathon in your sleep? These are classic clues. But because the bacteria can land anywhere, symptoms vary. If they hit your lungs, you might cough or feel breathless. If they reach your brain, you may get headaches or confusion. In children, it might just look like they're not growing well. Sometimes, the symptoms are so mild and general that doctors miss it at first. So ask yourself, are your small symptoms actually part of a bigger, hidden problem? Diagnosing miliary TB can be tricky, like finding invisible ink with a blacklight. Doctors start with your history and a chest X-ray or CT scan. If they see tiny white dots across your lungs, the miliary pattern, it's a red flag. But they need proof. So they might test your sputum, phlegm, blood, urine, or even take a small tissue sample. A blood test called IgRA, or a skin test, can show if you've ever been exposed to TB. Once confirmed, treatment is long but effective. 9 to 12 months of antibiotics like isoniazid, rifampin, pyrazinamide, and ethambutol. Think of it as a team of medicine soldiers kicking the germs out for good. The key, stick to the plan. Skipping pills can let the germs come back stronger, now resistant to treatment. Can we stop miliary TB before it starts? Yes, and it starts with stopping regular TB. In many countries, babies get the BCG vaccine, which doesn't always prevent adult TB, but can reduce severe forms like miliary TB in kids. If you've been around someone with active TB, a doctor might suggest preventive treatment even if you feel fine. It's like spraying water before a fire spreads. Also, staying healthy, eating well, managing diabetes, avoiding smoking helps your immune system stay strong. And if you're HIV positive, taking antiretrovirals is one of the best ways to protect yourself. Think of prevention as wearing a seatbelt. You hope you won't need it, but it could save your life. Here's some hope. Science is moving fast. Researchers are working on better TB vaccines beyond BCG. Some are in human trials now. New blood tests can detect TB bacteria earlier, even in hard-to-reach places. There's also progress in shorter drug regimens. Imagine curing TB in 3 to 4 months instead of a year. And scientists are using AI to study X-rays and catch miliary patterns faster. Some studies are even exploring smart inhalers that send medicine straight into the lungs. So while miliary TB is scary, the future is brighter. Imagine a world where TB is rare, like polio today. That's the goal, and we're closer than ever.